With 1 in 3 Indians expected to be overweight by 2050, health experts are warning that obesity could become a full-scale public health crisis if left unchecked. Rebecca Bundhun has more from Mumbai.
At over 120 kilos, Vishwanath Gaitonde has struggled with his weight for years. But now in his 50s, he's really feeling it.
As you age, the kind of problems that you start facing, your knees start giving in, your cholesterol starts increasing, your blood pressure starts going up.
India has more than 80 million obese people based on research by the global NCD Risk Factor Collaboration. That figure includes 10 million 5 to 19-year-olds. Doctors say sedentary lifestyles, fast food and genetic factors are major contributors.
Altogether, this changing era, preservatives, artificialization of food, ready-made food, everything together is generating a pandemic of obesity in India. And practically we see every third to fifth person, 1 out of every 3 to 5 is having some grade of obesity or is overweight.
Dr. Shah worries this could lead to an exponential surge in the number of patients developing diabetes at a younger age, and the strain it would put on an already overstretched healthcare system. Experts only see the problem worsening over the coming years. Another study, this one from the University of Washington, predicts that by 2050, India could have some 450 million people over the age of 25 who are obese or overweight. This means that almost a third of the country would be overweight. It puts India at second place on a list of countries with the most overweight and obese adults, right after China. India's Prime Minister Narendra Modi has urged citizens to consume less oil and exercise more. But like many overweight Indians, Vishwanath is also turning to weight loss drugs, particularly the American appetite suppressant called Mounjaro, which became available in India in March. It's primarily used to treat type 2 diabetes, but it's gaining popularity in the weight loss circuit.
So, as a person who really wants to lose weight and he's not been able, you do a lot of research, you do a lot of reading. And I've been following the Mounjaro thing since the last few years, and I was just waiting for it to come to India. In fact, I had half a mind to import it, but then the cost was prohibitive. I mean, obviously I couldn't afford it.
It would have cost him about $1,000 a month to bring in the medicine. Now that it's available here, he's paying $160 for the lowest dose, and says he's lost 4 kilograms in a month. Dr. Rajiv Kovil, who prescribed Mounjaro to Vishwanath, says having the option here is good. But he warns that weight loss drugs have their limitations.
Anti-obesity drug is not the magic bullet for India. It can only kickstart the progression of weight loss. Good lifestyle habits, good dietary habits, good exercise remain the cornerstone of weight loss.
Prevention is also better than cure, says Dr. Shashank Shah at PD Hinduja Hospital and Medical Research Centre in Mumbai. He says some weight loss drugs need to be taken for a lifetime and warns that long-term side effects are still unknown.
I think India definitely needs to take an action. There should be more awareness right from school, colleges, children, education.
Doctors say without early education and lifestyle changes now, India could have a much bigger health burden to grapple with down the road. Rebecca Bundhun, CNA, Mumbai.